One of the most fundamental skills of nursing is assessment. When nurses assess patients, we don't see isolated organs, bones, and insurance policies. We certainly don't see legal status. We see a whole human being. We observe how social determinants like diet, social relationships, economics, and the environment affect a patient's physical and mental health. Once we assess what's wrong, then we can proceed with the action of caring to help them heal. As union nurses, we also assess and care for our communities and our country, which is currently in critical condition.
As a nurse, I have seen firsthand the chaos and the destruction that Trump and his administration has caused.
The White House and Republican-led Congress are dismantling federal agencies, life-saving programs, safety regulations, and basic legal rights that protect us all. They're gutting Medicaid, which 1 in 4 of our children depend on. They're cutting Medicare, which provides health care to 72 million people. They're threatening Social Security, which protects 1 in 5 Americans from destitution. They're slashing staff and benefits for the Department of Veterans Affairs. Nurses know these attacks and more are deliberate and coordinated. The purpose is breaking the entire system of publicly funded programs so they can be privatized. All of this was outlined in Project 2025, which intends to create a modern Gilded Age.
You know, our country was the strongest, believe it or not, from 1870 to 1913. We had so much wealth, we didn't know what to do with our money.
Most Americans suffered needlessly, while the bosses and their cronies lived in luxury. There were virtually no public hospitals. Childbirth was the second leading cause of death for women, who did not have the right to vote. Only 1 of 5 children survived beyond their first birthday. Of the survivors, 1 in 5 began working full-time before they were 12. Workers' compensation didn't exist. The average life expectancy was just 46 for men and 48 for women. There was no Social Security for those few who survived to what we today call retirement age. And legalized discrimination condemned entire communities of Black and brown people and immigrants to being ravaged by preventable, treatable diseases. We cannot allow more than a century of social progress to burn away through attacks on public programs and democratic norms, mass federal layoffs, violence against political opposition, and terror created by mass detentions and deportations. The prognosis for our country may seem bleak, but nurses don't give up on patients in critical condition, and we're not giving up on our country.
We're fighting back.
The course of treatment is tried and true, and it's how everyday people survived the last Gilded Age, organizing collective power in our workplaces, in the courts, in the halls of power, and in the streets. Everyday people galvanized a massive shift in U.S. politics and a huge wave of reforms that made America healthier, stronger, and happier. We can do it again. Join nurses. Let's get better together.